Dr. Michael Tischler.
Thank you very much. Yeah, if you have any questions as I speak, just raise your hand and we'll get you a microphone. I just want to thank Dr. K for giving me the opportunity to address this wonderful conference. I've been coming here for years, and I think the venue change has been, I think it's an improvement. I actually really like the venue change because last time I was here I had to speak in the food court, so I'm happy being up here. So I kind of have a potpourri today of dental health issues as they pertain to females and basically anybody. And what I'm here to say is that a trip to the dentist is really more than just fillings and cavities. This is a real health issue. And I'm going to show you how there's a real oral systemic connection, that the health of your mouth really reflects on the health of your body. And you could see, this is the cover of a dental journal talking about this oral systemic connection. And it's something that's real, and it's something I feel that everybody should know about. And if you're trying to be healthy, and I think that's why people are here, this is pertinent information. As, they don't have a changer, so I'm going to kind of stand over here, I guess. And when you think about it, people see their dentist more than their physician. You know, we like to say we want to see you twice a year. So it's a real opportunity for us as dentists to really look at your overall health, and I'll show you what that means in a minute. It's imperative that dental professionals, hygienists, and dentists really understand this, and I'll show you some literature that really says that's not the case as much as it should be. This is a conference that was given last year in Chicago, the American Academy for Oral Systemic Health. So there's an awareness of this oral systemic connection that's out there more and more. So what I want to talk about today are these topics which have been kind of rearranged when I left my computer, but gum disease we'll talk about, which is really the crux of a lot of the problems that people can have from not having a healthy mouth. And talk about how heart disease relates to chronic inflammation. Eating disorders, we'll touch on that. Osteoporosis, pregnancy, missing teeth, and somewhere under there is also about cosmetic dentistry, which has to do with self-esteem. So let's talk about gum disease first. It's very prevalent. 75% of Americans have some form of gum disease. And these are the facts. And what happens is, in the mouth, and I wish I had a laser pointer, on the right side, you could see that's a disease state around a tooth. On the left side is a healthy state. And basically, when the gums are healthy around a tooth, the bone level's high, the gums are pink and red. But when you start to get inflammatory disease, what happens is the bone gets reduced, the gum reduces in height because the bone supports the gum. And I'll show you the signs of this. But what happens is there's an inflammatory process that goes on that goes into your bloodstream and affects your entire body. Some of the symptoms are pain, redness, spaces between your teeth. There's movement of teeth, bad breath. I mean, these are pretty obvious signs. But these are signs that when you come to your dental professional, the hygienist or the dentist, when we do our exam, we could spot these things. Some of the causes of gum disease are, one of the big ones is genetics, and you can't change that. Smoking, you know, one of the first questions I ask my patients is if they smoke, and I just think smoking cigarettes is really one of the most ridiculous things a person can do as a choice in their life, and we really deter that. But all kinds of things affect the health of your gums. Stress, certain systemic diseases, nutritional issues, and hormonal issues, and we'll talk about pregnancy also. The fact is that when you have gum disease, it's been related to stroke incidence, Alzheimer's disease, diabetes, heart disease, premature birth, and gastric ulcers. So this is important. You know, you're trying to be healthy, and if you have gum disease, not a lot of people know that a correlation between gum disease and these health issues. This is the cover of Time magazine talking about how inflammation is related to heart attacks and Alzheimer's, and this is important. Inflammation affects the whole body, and when you have gum disease, that's inflammation. When you treat gum disease, you reduce something called the C-reactive protein. In the bloodstream is a protein called the C-reactive protein that inflammation causes. So we can measure this. When you treat the gum disease, the C-reactive protein diminishes. how do you treat gum disease? Well, there's different ways to do it. We can do it by something called scaling and root planing, which we do in the office. We do something called periolase, which I'll show you in a minute, which is an amazing thing that we've been doing for the last 4 years in our office. We could give localized antibiotics. One of the main ways of treating gum disease is with behavioral modifications, using a water pick, flossing, and that's another reason when you go to your hygienist or your dental professional, we're going to teach you how to do that. It's really important. This affects your whole body. This is the periolase, and if you look at the upper left, that's an x-ray showing a lot of bone loss. By using this special FDA-approved protocol, we can actually regenerate tissue, which can't really be done any other way. And I did periodontal surgery for years, and I couldn't even do this. So I don't even do that anymore. This is an amazing thing that we do offer, and it's offered in other facilities. As far as home care, we have 4, I feel, the best hygienists on the planet. And we advocate the water pick in our office. It's a great way to, on a daily basis, just irrigate out bacteria, stimulate the gums. This is something that you really should get to know if you want your mouth to be healthy. It's a very easy thing to use, and it's very, very efficacious. So gum disease, with the inflammation that it causes, creates problems for your body. When you have inflammation in your body, you can have heart problems. And researchers have found that people that have had heart attacks have significantly higher amounts of gum disease. So there's a correlation there. So if you want to have a healthy heart, you want to have healthy gums. And it's not hard to do. Women account for more cardiac problems than males. And I think that's pertinent information for this Women's Health Expo. And I think that knowing that is something that's certainly useful information. Although diagnosing coronary heart disease in women has been more difficult because the pain that a female has when having cardiac symptoms is less specified and often misleading. And this is changing as the knowledge of this is improving. It's important for dentists and dental hygienists to understand this key role of inflammation and how it relates to cardiac problems. And I think more and more that's the case. But I just wanted everybody here to be aware of that relationship. When you talk about measuring, when you go to your physician and they measure cholesterol, when you measure the actual C-reactive protein in the blood, it's a better predictor of having a heart attack, the predictability of having a heart attack, than cholesterol. And I think that's an interesting fact, and that's due to inflammation. And having poor dental hygiene is also characterized by having an increased risk of cardiac disease. So that talks about inflammation and heart problems and how it affects your body. Something that's prevalent with females is eating disorders, which is a very, it's a sad thing, but it is very prominent. Eating disorders such as anorexia nervosa and bulimia are increasing. And I think a lot of this has to do with society's role in purporting that slim look and all the things that the TV shows and magazines do that make it very difficult for young females especially to try to live up to. And particularly young females, it's a big concern for women's health. As many as 95% of bulimics and anorectics are female. So that's a pretty high proportion compared to males. Mostly those in the middle to upper class socioeconomic group, 17 to 21 years of age is the average patient. What happens is when someone is bulimic, they're bringing up gastric content, and what it does, it affects the teeth in a negative way. And on the upper right, you can see the back of the teeth that are all eroded away. So that's the dental issue that happens when someone does this. And what it does is it causes decalcification of the enamel, and the teeth basically wear down. These manifestations of the teeth wearing away and other things I'll show you in a minute are not apparent sometimes for 2 years. So this is once again why it's important for the dental professional to kind of watch this as a parent. If you have concerns about your kids, you may want to talk to your dental professional about this. So it's a real issue and it affects a lot of people. Dentists are often the first to see this. And in our office, we've brought this to parents' attention before. We also look for traumatized oral mucosa, because that's another symptom of the irritation from this disease. And unfortunately, dentists really have a low score as far as understanding this, diagnosing it, and I'm hoping that's going to increase over time as the awareness of this occurs. When someone is bulimic, some of the things that we do to offset that is to recommend fluoride rinses, because fluoride will mineralize enamel. Interesting note is not to brush, have a patient not brush if they're going to have that gastric acid in their mouth, because you're just going to basically rub it onto the teeth and it's going to cause more problems. Psychological counseling is certainly something that needs to be done. And also gum disease, addressing gum disease from that. Osteoporosis is something that affects more elderly people than a younger population, as does these eating disorders. And it's the most common skeletal disorder, is osteoporosis. And basically, what happens with osteoporosis, when you think about it, bone is an organ, and bone wants to be in a homeostatic mechanism. That's why if you start to lose too much bone, that's osteoporosis. But if you, believe it or not, there's a disease called Paget's disease where you have too much bone, and it's, what happens is bone is in a homeostatic mechanism with hormones in your body. And this is what happens with osteoporosis, where osteoclasts will reduce the bone more than the osteoblasts that form it. It's a leading cause of fractures in postmenopausal women, and this is related to hormonal changes. And we often hear about elderly people in the nursing homes falling off the bed and fracturing their hips. It's because the bones are fragile. How does this relate to dentistry? Well, it seems that the research indicates that the loss of bone associated with osteoporosis may also be associated with, once again, with periodontal disease. So, I can't overemphasize the importance of having a healthy mouth and healthy gums. So here we have heart disease, we have inflammation, we have stroke, and now we're talking about osteoporosis also related to gum disease. It's something that, as a choice that you can make by either having better home care, seeing your dental professional, but this could be addressed in a pretty easy way. These are real issues. Some of the risk factors for osteoporosis, once again, genetics, and we can't fight that, but you certainly can affect your choice to smoke. Menopausal women, because of estrogen deprivation, is certainly a risk factor for osteoporosis and something to consider. Alcohol interferes with vitamin D synthesis, and vitamin D synthesis helps with calcium absorption, so there's a whole cascade of reactions there from that. How do you prevent it? Exercise, because bone thrives on what's called a piezoelectric effect, so it wants to be stimulated. It's like we're going to talk about dental implants in a minute, and what a tooth does, it stimulates the bone. Once you remove a tooth, you lose bone. It's the same thing. If you don't exercise and put stress on the bone, it's going to resort. Vitamin D, milk, some sunlight, dental visits, nutrition, and caffeine has a relationship to bone loss also. Any questions about that, what I've covered so far? Now this is interesting, how osteoporosis relates to dentistry. Because if a person is taking an osteoporotic drug, such as a bisphosphonate, either Fosamax or Beniva, these drugs have a correlation with a higher propensity for what's called osteonecrosis. And what that means, osteonecrosis is a really bad bone infection where it just doesn't want to heal. So when I have patients that are on Fosamax or Beniva or one of these bisphosphonates, we actually have them sign an informed consent form, because if I'm going to take out a tooth or we're going to do a dental implant and do dental surgery, that patient is at higher risk for there to be a bone infection that's going to be very difficult to heal. So the risk is very low for the oral bisphosphonates. And when this came out about 5 years ago, that there was a correlation between this and dental infections, the dental field really panicked. And we were afraid to do anything on someone on these drugs. But the original studies really came from mostly patients that were having treatment with the IV bisphosphonates from having lung cancer or something like that, not to lose bone. And that's when the real problems happen. So we call this a consideration and not a contraindication. So we still proceed with dental oral surgery with patients on these bisphosphonate drugs, but we just make them aware of it. Oftentimes we'll confer with their physician. But I've done a lot of surgeries on these patients and it's not been a problem. The next thing we'll talk about is pregnancy and oral health. And as I said, this is a potpourri of topics. I was asked to speak here, and I'm just bringing up issues that pertain to females with dentistry. And the changes that happen in the oral cavity when a woman is pregnant are numerous because of the hormones that are going on in the body. And these include increased cavities, tooth mobility, dry mouth. And when a patient has a dry mouth, that really has a lot of ramifications because if you don't have a lot of saliva in your mouth, you have more propensity towards decay, gum problems. So it's a cascade reaction there. Another thing that can happen is something called pregnancy granuloma. And that's also a hormonal type situation. Now, I'm sure we've all heard that a tooth lost for every child. That's like an old saying. It's not true. There's no chemical, histological, or radiographic evidence for that. And when a female in my practice is pregnant, we want to see them more often. Because once again, if we could address the gum issues earlier and get rid of the inflammation, we could circumnavigate these problems. And the main problem with the woman being pregnant with the hormones in their body is what's called increased gingivitis, more bleeding, redness of the gums. And if you don't address that early, like anything in the body and health, it goes into a more advanced state. So this could be dealt with just from having more cleanings, better home care. And this is more noticeable in the second trimester, and it peaks around the 8th month of pregnancy. There's something called pregnancy gingivitis. That's a term that we use, and basically it's just increased inflammation. But once again, if you could address it early and address it at home, it's dealt with quite easily. The other thing that we want to talk about with pregnancy is, other than increasing the visits, is gestational diabetes, which is also something that occurs at times when a woman is pregnant. And basically, once again, periodontal therapy, treating the gums through either deep curetting or home care shows benefits to stop that. So I keep going back to healthy gums. And here we're talking about now 5 different things related to healthy gums, and now we're talking about gestational diabetes. It's important to have a healthy mouth. The dentist has a big role in health in your life, and these issues are real, and it's in the literature. Now we're going to talk about my favorite topic, missing teeth and dental implants. And this is what I do in my practice. And this really is quite an important topic because if you look at the studies from the CDC and other governmental agencies, 10% of adults are missing all of their teeth. 1 out of 10 people in this country. Almost 20% are missing teeth in one or the other arch. That's a lot of people. 45 million people are missing teeth, posterior teeth in one or more quadrants. And what happens is, when you're missing teeth, there's a lot of ramifications that come along with that are not good, both physiological and psychological. If you go to the CDC website, this is online, in New York, 22% of the adults over the age of 65 are missing all of their teeth. 22% over the age of 65. That's a lot of people. And these are facts. What happens is when a person is missing all of their teeth, they can't chew well. It causes stress on the adjacent teeth because now there's missing teeth and it causes a cascade of problems. When people are missing teeth, they lose bone. They start to change the way their whole mouth, their whole face looks. Lips look thinner. The face starts to drop. They lose tone of muscles of facial expression because now the bone isn't there to support that. So you talk about cosmetic dentistry. This is really cosmetic dentistry. People have more lines in their face. The lip drops down. Muscles don't move the way they should. Now, when someone is missing a tooth, traditionally, dentists have made these appliances, dentures and partial dentures. And for the last 15 years, I've been on a mission to say this is not the best thing to replace missing teeth with. And my mentor, Carl Misch, calls these prosthetics oral wigs, because that's what they are. They basically sit in the mouth, but they look like teeth, but they don't really function like teeth. So we try not to do these options. They are available in certain circumstances, but it's not our #1 choice. What happens is when a person is wearing this oral wig or a denture, it puts pressure on the bone. And when there's pressure on the bone, bone is lost faster. Doesn't always happen, and it's related to different variables as far as the patient's health, the thinness of the bone that was there prior to a tooth being taken out. But the literature does show that denture wearing causes bone loss. And what happens is when a patient is in their 50s or 40s and they start wearing a denture, now they're in their 70s or 80s and they've lost bone over the next 30 years, that denture doesn't fit very well. And that's a whole other list of problems. People that wear these devices don't like them. They can't speak well, they don't find them comfortable. It's just not the best thing to do. When you think about how many things in our lives are related to food, social activities, going out to dinner, celebrations, it's an important part of life. So when someone is wearing one of these devices that really doesn't allow them to chew that well, they don't feel good about themselves because their self-esteem is down. This is a life-changing thing. And this is why I like dental implants. It's a much better solution. So instead of having this appliance that doesn't work very well, doesn't make someone feel good, we now can implant a titanium post in the bone that will support much better options. And this is what we do in our practice, and this is what I've done for the last 15 years. And this is the concept of a dental implant. On the right side is a titanium post. On the left side is a cross-section of what a tooth is. So it's a very similar analogy, but once this goes into the bone, and the bone actually kind of grows around it. And like I said a second ago, that when the tooth is removed, the bone is going to be resorbed because it doesn't have that piezoelectric effect. But now when we place this titanium post, the bone now thinks it's a tooth. So the bone is not lost. That's a very powerful thing. The concept of replacing teeth with implants have been around for a long time. This is a picture of a skull from 600 AD, and it shows shells that are implanted in the bone. And this patient did not die of that implant. These were in function. So the concept of doing this has been around. When you compare the success rate of dental implants to other prosthetically replaced things in the body, like hips and knees, it's a much higher success rate. So this is not experimental. This is something that works. It's been around, and it really can change lives. In our office, I don't place one dental implant without a CAT scan. And we have a low radiation, it's called cone beam CT. And we look at where we're going to place the implant from a three-dimensional view. We plan it, and it's done in a very safe and predictable way to avoid anatomy and have it really support what we want it to support. But this is the concept. We put a titanium screw in the bone. We then attach one tooth or more. Here's an example, and I promise you there's no bloody slides here. I'm going to keep it good. But here's a patient that's missing a tooth, and I plan to replace that missing tooth on a CAT scan. This is a cross-sectional view, and that's what it looks like. You can see the dental implant on the radiograph, and next to it is a tooth. We now can attach a crown to that, and you wouldn't know it's an implant. That's the concept. When someone's missing more teeth, like this woman comes in and she's missing all the teeth in the back of her mouth and she's wearing a partial, those are the hooks for the partial, how do we go from there to there? Well, it's done with careful planning in a sterile atmosphere, very safe. But look what this woman has now for the rest of her life, and she's in her 50s or late 40s. So it's a real game changer for a lot of people. And this is why we really believe in dental implants and the effect it can have on people's lives. This is my associate, Dr. Claudia Patch, her and I together work as an implant team. And we have our own lab in our office, and it's kind of a neat situation. But everything is done with a CAT scan. It's done very carefully, and it's an amazing protocol. I'm just going to mention this because when someone's missing all of their teeth, we have a protocol now that allows us to replace those teeth with something that is actually rather amazing because it's made out of something called zirconia. And in the past, this has been made out of plastic, which is more susceptible to wear. This will not wear or chip. This is a long-term prosthesis. And we're quite proud of this, and you might have seen this advertised, but it's just an amazing thing that we're doing in our office. And the last thing we'll talk about is something that relates to self-esteem, and that is having a pretty smile, cosmetic dentistry. And by having a smile that you're happy with and you're proud to show, it really affects your life in a lot of ways. Almost all Americans, except for 0.3%, believe a smile is an important social aspect. And I like this quote from Mother Teresa: every time you smile at someone, it's an action of love, a gift to that person, a beautiful thing. It is. I mean, a smile affects you in a lot of ways, from a business standpoint, from a social standpoint. And if you're not smiling because you're ashamed of your teeth, this is something that could be done that will really affect your life in a lot of ways. Most adults believe that an attractive smile makes a person more appealing. That's pretty obvious, but it's true. Most people feel that, adults feel that an unattractive smile can hurt a person's career. That affects your life in a lot of ways. I mean, I think I'm biased because as a dentist, I tend to look at teeth more than other people. But, you know, it really can affect your life. What's the first thing you notice in a person's smile? And these are things you may not really realize that you notice. And of course, as a dental professional, I do. But we're looking at the color. We're looking at how straight the teeth are. These are parameters. And, you know, beauty was defined by Leonardo da Vinci years ago. And he kind of put it into a mathematical formula. When you look at something that's attractive, there's a certain mathematical measurements that make it so. And Da Vinci did that very eloquently. But, you know, are there missing teeth? How straight are they? How clean they are. So these are things that we could change. The most common responses that people saw were these things. But now look at this woman. You know, if I showed you this slide with a missing tooth, she would not be as attractive. You know, or if the teeth weren't as symmetrical. And there's something about her facial aesthetics that kind of tie it all together. And a lot of that's really tied to her mouth and her teeth and the proportionality. And these are things that we can do and we could change. So I guess I'm trying to say it's an option that's available. How is it done? It's done with porcelain veneers. It's done with crowns. We do something called bonding, bleaching, orthodontics. So I'm just going to briefly go through what's a veneer. A veneer is a very thin piece of porcelain that we kind of attach to the tooth. And by doing that, we can change the shape of the tooth, we can change the color of the tooth, and this is a permanent thing. Yes? If someone's grinding all their teeth away, just ask that question.
What if somebody is grinding their teeth?
Well, what we do is when we treat and plan a cosmetic case like this, we're looking at everything. We're looking at the health of the gums. We're looking at the bite relationship. We're looking at, do they grind their teeth? So if someone is grinding their teeth, we're going to take measures to use materials that are not susceptible to fracture. We're going to design the occlusion so that doesn't happen and there's no breakage. We're going to also make sure you have a night guard that you're going to wear after the work is done. So at night, when most people grind and brooks, they're not going to damage things. It's like a shock absorber. A lot of people grind. They really do. It's more prevalent than most people think. I would say that's something that we address quite often in the office. So you're not alone if you do. So veneers are a wonderful way, in a very non-invasive way, because we don't have to take away a lot of tooth structure and we can make a pretty big difference. And this is what they look like. Here's an example of a woman that had veneers, and you could see, you know, it makes quite a difference. This could be done in 2 visits in about 3 weeks. How about that? How many things in your life in 2 visits, 3 weeks can make a change that's so permanent? It's powerful. Another example. The other thing that we do is something called crowns and bridges. And why I'm bringing this up is because now, instead of doing a bridge on the top, in the past we've done bridges with metal and porcelain. We're now doing it out of one material, basically, zirconia and or porcelain, which doesn't have any graying metal to it. So it's much more aesthetic, much more biocompatible. And you've all seen probably some older crowns that have that graying at the top. That's not the way it is anymore. So that's changed. Here's another example. These are all porcelain zirconia crowns. And look at the difference between the upper and the lower. It's pretty dramatic. Here's another case. And that's a case where somebody was a grinder. If you look at the bottom jaw, those teeth were ground down. So now we could change the whole architecture of the mouth by doing these crowns and bridges. So over and over again, we could change the entire look. In our office in Woodstock, we are very lucky and honored to have our own dental laboratory, where we actually could create this in our lab. And it's all done via CAD CAM, and it's a pretty unique situation. Dentistry is changing. Like, we're not taking impressions anymore with that gooey stuff. Everything's done digitally. We scan it. We design a CAD CAM. We mill it. At least in our office we do. And I think you're going to see that more and more as time goes on in the dental profession. But it's quite amazing, and just getting better and better. So in conclusion, going to the dentist is a lot more than just teeth. It affects your life psychologically, physiologically, and my purpose here was just to bring more awareness to the importance of your mouth and how it relates to overall health. We have a great website, tischlerdental.com. I encourage you to go there. We're accessible by email if you have any questions. And I thank you for your attention.